You're welcome back to News Desk on Joy News on Multi TV. Now, by the year 2030, depression is likely to be the leading illness globally. This is according to the World Health Organization. Today is World Mental Health Day, and even if you don't suffer from mental health issues yourself, there are still ways you can get involved. Hence, this year's theme, Psychological First Aid. I have a guest in the studio but for this discussion, but let's start off with this piece on bringing psychological illness home.
Strapped to the earth and walls by chains and padlocks, with a mat on the bare floor for sleeping, such is the plight of many mentally ill persons in Ghana. This is a prayer center called Mount Horeb. The conditions here immediately register the extent of restriction, whilst the stench in the rooms explain how long persons with various psychological problems have been kept here in their search for healing.
Writing on the walls. Fine. Any crisis from the father's house, from the mother's house.
Prophet Neokai is leader of Mount Horeb Prayer Center, where he prays for all kinds of people, including persons with psychological problems.
We thank you in Jesus' mighty name. Amen.
Amen.
A non-governmental organization, Basic Needs, collaborates with the Mental Health Society of Ghana to protect interests of the mentally ill and advocate caregiving at home instead of the psychiatry. Today, its programs coordinator, Humphrey Kofi, has come to visit Mount Horeb.
Oh, good morning. 1 minute. Holy Spirit touch. Jesus' mighty name. Holy Spirit touch. Holy Spirit touch. Holy Spirit touch.
Humphrey is taking on a tour of the facility to interact with the patients. More than 130 people, both male and female, are currently housed here at Mount Horeb, some for as long as 10 years. Prophet Neokai shows Humphrey where the most violent people are kept and explains his healing approach.
We tried by giving them injections that will make them become weak or sleep, so that we do our normal prayers. But at times the injection even makes it very worse. They become more violent. And so the best way to keep them is to put them in the chains. But I think if we have very good support, we can have something that can confine them, or maybe one each in the confinement, and we do the prayers till they are healed.
Fasting is also considered therapeutic.
But are you fasting?
And they say fasting.
Okay, so you've been doing the fasting?
They do.
Okay.
But first time I come, they buy my mother I be that. No, they buy cake for me. I don't be small guy where they
very good. Very good. Thank you so much. Right.
The new mentor.
Now, Adams Dokrugu Yahya is the Programs Director for Basic Needs, an international non-governmental organization working to improve the lives of people living with mental illness and epilepsy. Adams, welcome to News Desk.
Thank you very much for having me.
So today is World Mental Health Day. First, tell us, what have you been finding out on the ground yourself?
What we found out is that mental health is a reality. Whether you believe in its existence or not, it is a fact of life that there are people who suffer ailments which are not physical in nature but has to do with conditions of the mind. So it is a reality that we have come to accept, and it is prevalent in Ghana.
Based on what you found, is it increasing, a lot more people getting mental health, illnesses in different ways?
Mental health is on the ascendancy in Ghana for so many reasons, which we may look at later on. But if you work with the healthcare professionals, you will realize that the number of people going in for treatment, if you go to work in the community with families or people with mental illness, you realize that each day, each time you visit a community to meet with mental health service users and their caregivers, at least there are always new members coming on board.
Are you able to give some comparative statistics? Maybe if in 2012 there were these numbers of people suffering from mental illnesses as compared to 2016?
I may not be able to tell you offhand that in 2012 this was the number and in 2016 this is the number. But if you look at globally what the WHO estimates for us as a country, if one in 4 persons is likely to suffer one form of mental disorder or the other in his or her lifetime, then we're looking at a great chunk of our population, that is more than 2 million people, likely to be suffering from or are likely to experience one form of mental disorder or the other. But we see a few on the streets, that is the chronic mentally ill, and they seem to constitute about 1% of the total population likely to experience one form of mental disorder.
Do you think the illnesses are increasing amongst people because, you know, there's a stigma attached to somebody going to go to the hospital to check on his or on her mental status? So people keep it until it gets out of hand, and thus it's increasing the number.
The stigma may not be the cause, but it may contribute or it may influence the way people seek treatment. So yes, it might occur at a stage. The people or families with relatives with mental illness may begin to seek treatment only after it's been aggravated. First of all, people will usually want to seek treatment either with a traditional healer, especially in the rural areas where mental health services are highly inadequate. So their first attempt at treatment will be to go to either a spiritualist or, in traditional parlance, they say an elder, somebody they think can see and give an impression about the cause of the ailment. But sometimes that is how it goes on, and if the prayer and the other interventions don't work, you only find that they get to the hospital at an aggravated stage, and that makes it a little more difficult to manage.
Do you think we need a nationalistic approach in dealing with mental health issues?
It is even a global matter, and I dare to say that mental health is a concern for all. It must be a concern for all, because as I always say, mental illness does not discriminate. It doesn't discriminate among men, women, you know, boy, girl. It doesn't discriminate among professions. You know, we have teachers, we have doctors, you have media people like you, the public servants, you know, doctors, everybody. There's nobody immune. Nobody's immune from mental illness, and it cuts across all peoples of the earth.
Now, this year's theme is psychological first aid. How does Basic Needs understand this theme?
We think that mental illness need to be tackled, you know, at the very onset, you know, when it shows up, and we think it should be done at the lowest level of health care. That even at the CHIPS compound, you know, in a village or a community, there should be an immediate response. The person should be able to go to a CHIPS compound. There should be a nurse with some know-how to be able to give an initial impression that this is likely to be a mental health condition and not a physical condition, and for that matter, needs to be referred. So yes, we think that psychological and mental health first aid is really necessary, and the theme for me is very apt.
Now, you do a lot of research in this particular area, and the World Health Organization is saying that by 2030, depression would be the leading illness. Why do you think the WHO is saying this?
So many reasons may account for that. One area of depression that has gone unnoticed is maternal depression. Depression associated with women who are pregnant and women who have children below 2 years. The reason is that there hasn't been any conscious screening of people, of pregnant women. You know, for now, it is now part of screening for pregnant women to be screened for HIV/AIDS. You know, that's what they call the head to toe. You know, they take your BP, you go for a test for your urine to ascertain the levels of sugar. So, at least for HIV/AIDS, pregnant women go through the test. But for depression, you know, nobody that screening for pregnant women. And
why is it critical for pregnant women and women who have children under 2 years?
It is critical because a woman who is suffering from depression cannot properly take care of the baby. When her life, she is not well herself, her mood is affected. So once she is not in the right frame of mind, she will not be able to take care of the child properly. Remember, the child has to take some immunizations. So if the woman doesn't even have the energy, the drive, to even wake up, sometimes the baby is crying, she doesn't even respond. The baby needs food, she doesn't respond to the baby. How will she even think of taking the baby for, for immunization?
And for those who are pregnant, is it that pregnancy increases the depression rate in women?
There's a lot of stress associated with pregnancy. And that is why it is important for a lot of family support to be given to pregnant women. One, there are changes in the body of the woman. The appearance will have to change. She's carrying another person within her. There are a lot of expectations. Some will say, I have 2 boys, I need a girl. Maybe the family is anxiously waiting. So even before the child is born, the woman is put under some sort of pressure that I must necessarily bring forth a boy. Now, if the baby turns out to be a girl, that is a matter for her. So there's a lot of expectation, there's a lot of anxiety. She has to be, her budget will have to change. I need to buy diapers, I need to buy clothes, etc., etc. I need to prepare for naming ceremony. She has to couple that with her, if she's a working mother, you have to couple that with work at your former workplace, and then even your domestic chores. In some cases, your domestic chores doesn't reduce.
Now, let's wrap up this conversation. On this day, what would you tell people?
What I would tell people is that, as I said earlier on, mental health is a concern for all. We need to rethink about our attitude. We need to rethink about the way we behave towards people with mental disorders. They need to be accepted. They need to be treated with dignity and respect. They need to be, their rights needs to be upheld, as a nation. And we should, see them as part of us. Stigma only entrenches negative attitude and behaviors towards people with mental disorders. And I think that the earlier we begin to deal with issues of stigma, we'll eradicate issues of exclusion and marginalization of persons with mental disorders. In that case, when that is done, we begin to see them as part of our national development. Our planning includes them. Our national life, tends to have them at the back of our mind, rather than thinking of them as an afterthought in our development agenda.
Thank you very much. Adams Dokurugu Yahaya is the Programs Director of Basic Needs, and Basic Needs is an international non-governmental organization. Thank you for sharing your views with us on this. Meanwhile, Medical Director of the Accra Psychiatric Hospital, Dr. Pinaman Apau, is encouraging the general public to educate themselves on psychological first aid.
This is that. The psychological first aid being given it's not necessarily, let's say, psychiatric health worker or a mental health worker who should give. Other people could give these psychological first aids, like teachers, other health workers, and so on, people in communities and so on. These people are there to, for instance, if someone loses his, let's say his spouse or her spouse, then this person is there to listen to the person. Even just listening to the person pour out her emotions and so on, it's a form of first aid. We are not saying counsel the person or tell the person whatever, but just being there, supporting this person is a form of first aid. Teachers should be trained to be able to identify some of these things, and also sometimes children are more comfortable also with their teachers, and they may tell their teachers certain things, and therefore the teachers should be in some position to be able to help them. So it will be okay to identify them and give them some of these guidelines. They can read it on themselves. They can go onto the website, WHO, I think it's there. They can just read through it, and I'm sure they can be able to help.
This is News Desk on Joy News on Multi TV. When we come back, Emmanuel Abuaji Wiafe will join us with the latest in the world of business. Stay with us.